Hi everyone, this is Dr. Bill with EZ2PASSNCLEX, EZ2PASSNCLEX.com. So today's session, I'm going to be reviewing tuberculosis, also known as TB for short form. So what is tuberculosis? Tuberculosis is mainly infection caused by Mycobacterium or Mycobacterium tuberculosis. It usually causes the disease through aerosolization, which is why we call it an airborne infection of the respiratory tract. So what are some risk factors for tuberculosis? Risk factors include people who are older in a homeless population, people in crowded places, foreign immigrants, people of low socioeconomic status, and then also people who come in contact with diagnosed or infected candidates. What are some nursing assessments that you're going to find, consistent with people with tuberculosis? So they are cough, hemoptysis, low-grade fever with some night sweats. Notice the night sweats are classic symptoms, for tuberculosis. Anorexia, malaise, fatigue all the time, and then also irritability as well. And most importantly, positive test for sputum culture. So what are some nursing interventions? And even before we get into the interventions, you want to think of some diagnostic criteria. Diagnostic criteria include the Mantoux test. We also consider the PPD testing, which is the same. The PPD testing is basically they inject purified derivative under the skin, and then they read the results within 48 to 72 hours. There's also the quantiferon gold test, which is now the gold standard. The difference between the quantiferon and the PPD is that the PPD candidates have to return back for the reading to occur. Oftentimes people don't return. Also, there can be false positive or false reading by people who are not really qualified or trained enough to read accurately. And that's why the gold standard, it's a one-time blood draw. The results can be available in several hours, and it will determine if it's positive or negative. So that's basically the difference. Both tests are still done, but the gold standard for quantiferon is what's preferred now, using evidence-based outcomes. What are some nursing interventions or treatment for someone who has been diagnosed with tuberculosis or suspected diagnosis of tuberculosis? First, you want to place them in contact and airborne isolation combined. Mainly, or the most important or the highest priority is the airborne because of the aerosolization. You also want to include and encourage fluids and hydration, for the client, because we need those mucus to be thinned and be able to expectorate by the client because of the constant coughing. You want to also teach the client to avoid contact with others unless they start treatment. You also want to make sure that the client is understanding of the treatment regimen. Sometimes the treatment regimen can take anywhere from 6 to 12 months. Using the medications for TB or approved for TB. And I use the acronym RIPE to help remember. The RIPE acronym stands for, the R is Rifampin, the I is Isoniazid or INH simply, the P is for Pyrazinamide, and then the E is Ethambutol. So that's the RIPE acronym for the TB treatment medications. So oftentimes when the client becomes resistant to the RIPE regimen, then they switch them to, or they can put them or place them on the fluoroquinolones. Example is Cipro or Levaquin, or also they can be on the aminoglycosides, also known as the tobramycin and the vancomycin. So you want to teach the client that while they're taking their medications, they may be getting screening for liver and renal functions because it has severe effect on the kidneys and the liver. So they may have to comply, with routine testing. You also want to teach the client to comply with these medications because once they start, the goal is that they complete the course and not stop when they start feeling better. The goal is to completely treat them off the tuberculosis so they don't infect others. So that's in a nutshell the treatment and the management for tuberculosis. Let me know if you have any questions. Thank you.